Hello, everyone. I am Dr. Walter Matwichuk, and I'm here with Dr. Wendy Dryden. We are the founders of the Academy of Rational and Emotive Behavior Therapy. And today we'll be talking about why professionals would want to train in rational and emotive behavior therapy over more traditional CBT models. So, Wendy, why don't you tell me from your vantage point, why would a professional want to train in REBT?
I see REBT as an approach to psychotherapy that is based on what I call an attitudinal perspective on human disturbance. When Epictetus said that people are disturbed not by things but by their views of things, we would take that and we would say people disturb themselves by the rigid and extreme attitudes that they hold towards life's adversities. And I think that this get to the center and the core of how people disturb themselves rather than start out in more surface cognitions to more intermediate cognitions before you get to the schematic cognitions as you will get in other approaches to CBT. We encourage people to not waste time and to get to the heart of the problem quicker.
Right. And would you see any other reasons beyond that? I agree with
Well,
you. The
well,
efficiency factor is there. There's no doubt about it.
I think the idea is also that REBT can be placed as having a transdiagnostic view of people's problems and how they can tackle them. We don't need a separate therapy for anxiety or depression or guilt or anxiety or anger, etc., etc. We have some core ideas. We do make discriminations amongst those different emotions, but we don't need a different therapy for people learning a particular approach to psychotherapy. It's my experience has been that it's most useful to learn some skills that you can transfer across the therapeutic domain, if you like, when you're working with clients.
It's interesting. I made that point this week to a student of mine who starting her first job. And I said that I think she's being integrative. And I said, I don't think that's going to work very well. I think it's better to have one framework that can be broadly applied, especially when you start. And RBT is that versatile framework.
Yeah. I mean, I think you raised a very interesting point about people who are new to the field and wanting to start off training. Should they train in a number of models roughly at the same time, or should they really concentrate on one? My experience has been as a counselor educator and a therapy trainer, since the mid 1970s, is that people do much better if they learn a particular model very well and then they can use that as a base to integrate other approaches later on. If you try to integrate without the foundation, it's like kind of building a house without foundations. You can do it, but you'll soon recognize that cracks will appear and that your work will need to be underpinned.
I'm always a little skeptical of people who say they're integrative. It's like either they don't understand a particular model or they're afraid to commit to one, but they don't know it really well. I'm always a little skeptical when people say they're integrative. I
Well,
think you could be open minded.
yes, indeed. Certainly in the UK, when people say they are integrative, they normally integrate person-centered approaches with psychodynamic approaches, or they either miss out CBT or they miss out some other approaches that other people will include. It's not somebody says my practice is integrative. That doesn't really tell me. It tell me that you've made a cake, but it doesn't tell me what the ingredients of that cake is.
And here in the United States, I think when people say they're integrative, what they're saying is, well, I do a little mindfulness. I also teach certain skills that you might find in DBT or you might find in CBT, Becky and CBT, and challenge some inferences. But it just seems to me that when people say that, I'm always wondering if they have a commitment to any particular model, how well they understand any of the particular models. Are they trying to be
Yeah.
all things to all people?
I think the other thing to consider when you're thinking about which particular approach to training, if you're, somebody starting off in your career, is that it's not like surgery because surgery kind of, your attitudes don't seem to matter. You're not going to do surgery on yourself, so that's not going to be that important an ingredient. And I think you and I are good examples of this. That we were drawn to REBT because it was consistent in the ways that we have either helped ourselves or have learned to help ourselves. And I think that that is really an important consideration. And part of our training is going to be helping people to see how they can apply this theory of helping people to themselves as well as to other people, because that kind of makes you a more um, authentic and genuine practitioner. If you practice what you're preaching in your own life, then I think that is really important. If you want to train other people and work with other people clinically.
Going back to your previous point, REBT can also help people go beyond emotional disturbance. So
Yep.
you were that REBT can help people take it to their lives to the next level, and I think that might be a
Yes, I
reason.
think I think that if you look at some of the work that Albert did and taken on by people like Michael Bernard and Juana David and myself, we've applied REBT ideas to the field of coaching as well. And so, I always quote a book that came out in the late 1960s, edited by a man called Alvin Mara. It was called The Goals of Psychotherapy. And he had a number of noted people, including Albert, to write about what are the goals of psychotherapy. And he did a review of people's ideas. And he said, it seems to me that there are two major goals of psychotherapy. One is to help people overcome psychological disturbance, but two, to help them to become more well-rounded individuals, more psychologically healthy individuals. And I think that that's what REBT does, and I think that's what we're going to be trying to do in our training to promote not only that REBT can help people overcome their disturbance, but that it actually can help them to live more fulfilling lives.
Agree. I've been thinking about why I would pursue training in REBT. And the reason I would pursue training in REBT if I was, say, a master's level clinician right out of school, aside from the fact that I don't have to learn all these different protocols, I would have confidence that if I understand this one transdiagnostic approach, that I can apply it to pretty much any problem a person would bring into my office. What I like about REBT is it allows you to really prepare people for the worst case scenario, because my view is that life is hard, and that teaching people what we call the elegant philosophical solution is really inoculating. Not everybody necessarily gets it fully, but the idea that you don't have to have anything you want in life, no matter how badly you want it, will serve you well over and over again. And it empowers the therapist, and novice clinicians feel anything but confidence, or they feel anything but power. So if they learn REBT, I think they're going to develop this genuine confidence that will serve them well when they face all these different kinds of problems people bring their way that seem at first to be unchangeable.
I think that's right. I think there are many situations where, although one can say that the person may be making negative distortions of reality, when you look at it, then they're not. They're quite accurate in their perspectives, and they're disturbing themselves not because they're making inaccurate distortions of reality, but because of the attitudes they hold towards their accurate representations of the significant adversities that they face. But I think that you said an interesting thing there, because I'm talking about when these adversities have happened. I think you're talking about how to prepare people for the possibility that adversities might happen. And I think if you are prepared for that, then you don't have to leave a situation because you know that you are prepared for the worst case scenario. And I think that that is an important aspect in REBT, and that is something which again is going to be featured in our training.
And the other reason people should seriously consider is the concept of unconditional self acceptance. It just seems to me that we really help people come to terms with the fact that they're imperfect humans, no matter how bright they may be, and that they're going to get themselves upset from time to time. They're not always going to do what is self helping. And the minute they start rating themselves, which they will do really quickly, they create a separate problem that can take on a life of its own. And I just don't see any therapy really teaching this idea that you're a fallible human and that you're going to rate what you do and stop right there. You're not going to rate yourself.
I think that's an idea that you could find in other therapies, but I don't think it's a foundational idea. For example, let's have a look at when I was first learning REBT back in the late 1970s. That was when Beck's first book on cognitive therapy was just, I think, gone to the publishers, and it came out in 1979. And I went there. That's where I met you in 1981, where I did just a training in Beck's cognitive therapy. When I was actually saying there, was I said, well, okay, you've got this idea of these rigid, musts, but we have these ideas in cognitive therapy. We have should statements. It didn't have a significant place in the theory. It was there, but and we're saying, look, we've got some foundational ideas here to teach people, not only to deal with their disturbance, but also, here to get the most out of life. And
Yeah, but I don't.
unconditional self acceptance is one of them, flexible attitudes is another. These are foundational ideas. Other people have them, but they're more peripheral.
Yeah, I always felt like in the Beckian model that those should statements were like hanging on to the tree like a leaf. They
Yeah,
were, as you say, and they were definitely they had rating scales on self-esteem, so they certainly, would attempt to get people to look at the distortions that lower their self-esteem and not inoculate themselves, for those big failures that and then the tendency to say, "I'm a failure." I think the emphasis on unconditional self-acceptance is very, very liberating. So the reason why I think somebody should preferably consider training in REBT is the liberation that you get as a psychotherapist, that you can accept yourself when you fail, because you will fail. You're only one ingredient in a clinical outcome, and arguably the most important ingredient. You're an important ingredient, certainly. That's why we collect a fee. But you're going to fail no matter how good you are, because the effort that people put into therapy matters a lot.
yeah. And I think that, along with that, the emphasis that we put on unconditional other acceptance, because increasingly we're currently in society label people with the beliefs that they hold. If we can really encourage people to have to view the complexity of an individual, and yes, they may hold ideas that are different from yours, but you don't have to kind of dismiss them as a result of that. Acceptance of the other person is helps you to engage in a respectful dialogue with the other people. If you have different ideas towards them, you don't have to wipe them out. And so I think that the emphasis on unconditional other acceptance is important, as is the emphasis on unconditional life acceptance. Some approaches have this idea of what they call radical acceptance. And I think, well, what's the difference between radical acceptance and acceptance? I mean, it's even more accepting than acceptance. I don't kind of get that. But, we argue that as part of acceptance, it doesn't mean that you have to forego your views about what you would like to happen in life, and you can still accept something that you don't like, but you acknowledge that reality exists and all the conditions are there for it to exist. And therefore, that's what we encourage people to accept, but not to be resigned to things, not to be complacent, not to give up striving for something that's really important to you. And I think that's the other thing that I like about REBT. In a sense, it really does encourage people to be persistent, to show grit, to kind of keep going. What I call the non-sexy aspects of psychological health. It's not as sexy as the self and other things, and compassion and mindfulness, but it's so important. I think a lot of people these days do not get as much as they could out of themselves because they do lack that kind of grit and determination, as an integral part of what life is.
And what I always find funny is the people the academics who research grit and then are hired by organizations to talk about building grit probably never have actually done therapy. People do research on therapy and then tell you how to do it. But I think that what REBT has been doing is been in the trenches with people, helping them overcome their low frustration tolerance or their low discomfort tolerance or their attitudes of unbearability or tolerating, things.
One of the things, as you're talking, what it reminds me of is that whenever I used to kind of, watch Albert doing therapy, either as part of being a co-therapist in groups or listening to the many recordings he used to put into a shoebox in the fellows training room, is how persistent he was with people who had, problems of low frustration tolerance. He didn't get angry with them. He just really was really quite persistent and encouraging, and kind of showed them that you can do it if you're prepared to kind of accept some sort of grim features of life, that things ain't going to come easy to you.
And they don't have to come easy to you, which is
That's right.
certainly against, I think humans would engineer perfect comfort if we could figure out a way to do it, right? But the other thing I think that a person may want to take into account is if you're going to be a full time practitioner like I am. So, for example, this week I've seen 36 patients. That's a lot of people. And if you don't have a way of thinking about your work that allows you to maintain enthusiasm, maintain hope, suffer some defeats, you're going to either burn out or you're going to not be a happy camper. And I think that what REBT does for me is enable me to continue to enjoy working with people because I, take the losses well, get a lot of positive feedback that I've empowered people.
Yeah,
But I don't make the assertion that everybody, loves REBT or gets better, but a
well,
lot
yeah,
enough do. It's common enough of an experience that people say, "Why don't other people do this?" And
that's
I'm
right. I
left having to
think I
explain
think
that.
that's right. I think REBT has suffered in the last 10 to 20 years because it hasn't marketed itself well. I mean, I use the term, I don't use, as you know, I don't use the term irrational beliefs anymore. But what really does seem to generate some sort of resonance with people is the idea of mindset. You can have a rigid and a flexible mindset made up of certain attitudes. And that seems to resonate with people when they're interested in, well, how can I develop a flexible mindset? So if we call it rational beliefs, we're essentially talking about the same things. But that's the other thing that we're going to be talking about in our training course, is that how to frame things that are gonna, make it interesting for people to kind of then to do the kind of the ongoing work that they need to do on themselves in order to live a more fulfilling and healthy life.
I do think that there's a appetite out there. I don't want to make gross generalizations about cultures, but there has been this trend towards ease and maybe not seeking to work as hard as we might. The old work ethic that I think made was very popular when I was growing up, and I think people are beginning to realize that taking responsibility for your life is a good thing to do. That we can go too far in the other direction, and so I think that REBT appeals to maybe sometimes an unstated wish for better sense of responsibility for oneself.
I think that again, then that's a term that really does need to be rehabilitated, in terms of responsibility, because I think people see it as, as equivalent to blame. It's got nothing to
Yeah.
do with blame. I think the idea as, that it does kind of go against the idea of victimhood, the idea that, I'm disturbed not because of the attitudes that I currently hold about the adversities that I think, but I'm disturbed because this is what happened to me in the past. So don't blame the victim. Don't kind of re-victimize me, if you like. And so we do have to, these are, sort of important times in the field of psychotherapy, particularly for those of us who do argue, which REBT does, that taking responsibility for yourself and your responsibility to other people. We're not saying just look after yourself and other people can go hang, but if you don't look after yourself, how the hell are you going to look after other people? And you made that statement that as a practitioner, if you don't look after your mental health, you're going to burn out far more quickly than if you neglect your mental health because you're seeing too many patients, you're not looking after yourself. So, we do owe it to ourselves and also to our clients to look after ourselves as practitioners.
The other thing I think is that we are not allergic to humor. And I think that anyone who enjoys smiling, and most people enjoy laughing, it's not against the professionalism that we teach. In fact, we actually see humor as a strategy for helping induce buy-in, helping people examine their attitudes. And so REBT can be a fun therapy to practice. It's not just that you have to be constrained by adherence to a protocol. We used to have a lot of fun at the Institute.
Yeah. Look, I think that raises for me a training issue is that I don't see myself as training people to use humor because I think I would see myself as giving people permission to kind of use the humor that they have. For some people, I remember many years ago when I was doing my master's training course in REBT, and there was this woman who I was listening to her tape and it was very, very dry. And I said, look, why not kind of use some humor? She said, I don't have a sense of humor. So I said, well, everyone's got a sense of humor. So the next time that she came back and she said, well, I've got some examples of humor on my tape. And I listened to it. I said, you know what? I think you were right. Just go back to the way you were practicing because not everybody can do that. And I think if you try to encourage people to be humorous and they don't really have that, as very kind of strong in their repertoire. But I think quite often the opposite is more damaging. When I was at the Center for Cognitive Therapy around the time that you were there, we all had to produce a videotape, and I choose one with humor. The answer is, oh, well, that's very interesting, Wendy, but could you have done it without humor? And I said, well, I could have done
Why?
it without. Well, because it wasn't part of the
No, no.
serious
Why?
business.
Why do it without humor?
Well, exactly. That's
Why
that's
is that
that's the
better?
question. Yeah.
I mean,
And so I think that the idea is that, which I think still around, that humor is a psychological defense. Now it can be, but it also can be really quite liberating for people. And often when I do work and do demonstrations, people do say that one of the helpful factors is the fact it was with the stand up. I'm not trying to be
yeah.
like a stand-up comedian, but to actually kind of bring some humorous perspective on things.
And I think that when you don't take yourself too seriously, which REBT talks about, then you're free to laugh at some of the own things that I know I sometimes will laugh at some of the stupid things I've done. And
So I think this is important because in a sense we're not is an REBT therapy training trying to teach people a particular style to do REBT. You can do REBT in your own style. The important thing is that you use, what REBT has to, offer you in doing REBT. We're not just saying you got to do it in this way, and it's so another reason what I didn't really take to cognitive therapy was I did feel that it was constraining in terms of style and personality. Again, with person-centered therapy, I did found when I originally trained in that, I found it constraining idea. So we are not going to, in our training, constrain anybody from using their own particular personal style, but we're going to encourage people to use their personal style, marry them to, the many things that REBT has to offer people as they do psychotherapy.
yeah, so we're going to liberate the psychotherapists to be themselves and at the same time to help them liberate clients to be themselves, to
That's
pursue
right.
goals that they want that may be unpopular with significant others, but they can do that without shame, without guilt, and at the
That's
same
right.
time do regard for the rights of other people. REBT really is a well-constructed system of ideas that I think people just don't have a good understanding of how cohesive the whole is. And one of the things that I talk about is the synergy of the whole. And my concern is breaking pieces off, like the should statements that the Beckians broke off and integrated in their model. And yeah, they do talk about deeper level schema and absolutistic beliefs. But again, it's more secondary. It's not foundational. If anything, the foundational idea in the Beckian model is the idea of inferences that are distorted and identifying cognitive distortions.
Yeah, they also. I remember seeing an article by Beck and somebody else on catastrophizing. That realize that, but it's somewhat different from awfulizing. We'll
Yes.
kind of get to the fine grain analysis of these ideas on our course because I think it's we're not just training people to do therapy well, but to kind of really learn to think as REBT therapists, not just to practice it, and to think like an REBT therapist is an important aspect of
Yeah, I wouldn't
what
be
we're going to do.
surprised if people at the end of our training year say that we've had a profound influence on them. I think REBT is the type of therapy that can have it's really a philosophy of life, if you ask
Yeah,
me. And then from it, we create a therapy from this stance. That REBTers have this stance that we don't have to have anything in life that we desire. We want it, but there's not anything we absolutely have to have. That's a really powerful idea. I mean, I'm tenacious in pursuing what I want, but I've come to terms with the fact that no matter how badly I may want something, I might not get it. And that's just the way it is. And that's a profound shift. That's a game changing shift. Whether that's about my own personality, or, other people and how they treat me and react to me or how life is, I never have to get what I want, but yet I'll pursue it. And so I
yeah.
wouldn't be surprised if people say at the end of this year, you guys have really had a profound influence on not only how I do therapy, but how I try to live my life, and I'm better for it. So now I know, Wendy, that you have a life outside of REBT. And so you want to go watch your soccer. So I don't want to hold you.
Yes,
I think,
Arsenal playing Paris Saint-Germain in the Champions League final. And so I'm hoping, well, certainly when people see this video, the result of that will be known. But yes, thank you very much for reminding me, because I got so caught up in our discussion, I kind of forgot it. But thank you. So let's kind of root for the Arsenal and let's see what happens.
all right, great, great. And Wendy, thanks for taking the time to talk to me and all you prospective trainees. I really would ask you to give serious thought to making a commitment to the training program, because I don't think it will
Always,
disappoint you.
always a pleasure, never a chore, Walter.
All right, take care, Wendy. Bye bye.
Bye bye.